Hello, in this video I want to talk to you about the very basic anatomy of the brachial plexus. And we're not going to look at it in great detail, we're going to focus just on the major branches of it and how it is formed. Now the brachial plexus is absolutely critical to having a sound understanding of the anatomy of the upper limb. I would argue that the brachial plexus is fundamental to all of the anatomy of the compartments, to the functional anatomy of the upper limb, and to our interpretations of any lesions that might arise within the upper limb itself. So what I'm going to do first of all is I'm going to talk you very quickly through this image on the left hand side, which is an anatomical overview of the brachial plexus. And then we're going to draw a little simple diagram of the brachial plexus and make some key points regarding its anatomy. Now, before we talk about anything specifically relating to the brachial plexus, let's just think about some generalities of these peripheral nervous system plexi. Now, to a student who has not been initiated into anatomy, the whole idea of a neural plexus, as we see in the brachial plexus, can seem quite bewildering. And it can seem random. It can seem like it has no order. However, that couldn't be further from the truth. And I'm going to try to argue that the brachial plexus is an excellent example of how anatomy can follow a logical pattern. Really, what the brachial plexus is a conduit, if you like, which allows us to distribute the axons of motor and sensory neurons, which are in the spinal cord here, out to the upper limb. Okay, so the brachial plexus is a specialized conduit which enables us to distribute sensory and motor axons down to the upper limb, all parts of the upper limb, including the girdle around the shoulder. And from a functional point of view, I'm going to talk in more detail in a different video about some of this. But the basic idea is that these interconnections between different parts of the plexus enable us to have a greater degree of functional versatility within the upper limb. So we can combine the nerves from different spinal cord segments to supply different muscles. And furthermore, from a clinical point of view, damage to one part of this plexus may mean that there is an alternative route that axons can get to ultimately re-innervate their targets. So this plexus provides us with a certain element of redundancy, enabling axons maybe to find alternative routes when they regenerate after injury. So let's start off by going right from the spinal cord in the midline. Okay, so you can see on this image that we have got the bodies of the lower cervical and the first thoracic vertebra here. And this brachial plexus arises from the spinal nerves C5, C6, C7, C8 and T1. And at these levels, these are known as the roots of the brachial plexus. Now, something very important I want you to appreciate is that the use of the term roots relating to the brachial plexus actually has no bearing on the dorsal and ventral roots that you might have encountered when studying spinal nerves. So if I do a very quick cross-section of just one half of the spinal cord, you should recall that we of course have got grey matter in the centre and then white matter around the outside, that we have a dorsal root coming off the back of the spinal cord and a ventral root coming off the front. You should recall that the ventral root is purely motor, whilst the dorsal root is purely sensory. However, these have nothing to do with the roots of the brachial plexus. The roots of the spinal nerves come together, okay, there's a dorsal root ganglion, and then it forms the spinal nerve itself, which splits into two major components. A large ventral ramus, which goes to supply the limbs and feeds into our limb plexi, and a smaller dorsal ramus that supplies our various intrinsic muscles of the back. And it is the case that the ventral ramus of our spinal nerve, is in fact what forms the roots of the brachial plexus. Okay, so it's just a bit of terminology which can introduce confusion. And I'll just say it again, don't think that the roots of the brachial plexus are the dorsal and ventral roots coming off of the spinal, contributing to the spinal nerves. So, we said that the brachial plexus is made up of roots which arise from the C5, C6, C7, C8 and T1 spinal nerves. It's interesting to note that how the majority of the innervation to the upper limb actually comes from the neck, okay? And clinically this is very important because certain neck conditions can manifest in the upper limb. The roots of the brachial plexus pass through two muscles within the neck known as the anterior and middle scalene muscles. The scalene muscles go from the cervical vertebrae at the top down to the first rib, and they're involved in bracing the first rib, which helps with ventilation. So the roots of the brachial plexus are found within the neck and emerge between the anterior and middle scalene muscles. Soon after that, the roots start to converge together to form the trunks. Okay, so you can see that the root of C5 and C6 come together to form the superior trunk. C8 and T1 come together to form the inferior trunk, whilst the C7 root continues alone as the middle trunk. Okay, and these are simply named according to their height, if you like. Superior trunk at the top, middle at the trunk in the middle, inferior trunk at the bottom. Now, the trunks are present within the neck itself, specifically within the posterior triangle of the neck, and they are in fact palpable in a thin individual and are in some cases susceptible to damage by, for example, a stab wound that could come down and involve the trunks of the brachial plexus. At this point also it is worth mentioning that if we follow these superior roots down through the upper limb, we see that there is a correspondence almost between the superior portion of the brachial plexus and the lateral aspect of the upper limb, and a correspondence between the inferior portion of the brachial plexus and the medial aspect of the upper limb. And that's a correspondence that's always worth remembering, especially when you're trying to think about the way that lesions present. So we have three trunks, superior, middle and inferior, which are generally formed by the convergence of the roots. Now the trunks go on to divide, to split, and the trunks divide into so-called divisions, okay? Now the divisions, I think, are the most interesting parts of the brachial plexus, because in fact the divisions split up the trunks into portions that supply flexor muscles and portions that supply extensor muscles. So you can see that all of the posterior divisions come together to form the posterior chord. And in fact, all of these posterior divisions will ultimately go on to supply extensors and be distributed largely through the radial nerve. Whilst all of the anterior divisions, so we can see there's the anterior division from the middle trunk, there's the anterior division from the superior trunk, and here's the anterior division from the inferior trunk. All of the anterior divisions will go on to supply flexors. Okay, so this is a key bit of anatomy that you need to be confident about, and it will help you to reconstruct the whole thing if you appreciate that posterior divisions supply extensors, whilst anterior divisions supply flexors. The divisions form just deep to the clavicle. Okay, so you can't palpate the divisions, and in fact it's quite difficult to see them in dissection unless you remove the clavicle. Okay, so the divisions are found deep to the clavicle. The divisions come together, so there's convergence again. The divisions come together to form the chords. Okay, the chords. And the chords, when we get to the level of the chords, we're really starting to get to a point where we're able to distribute these nerve fibres to the various upper limb compartments. Okay? There are three chords, the lateral, posterior and medial chord, and they get their names from their relation to the axillary artery. So the chords are found within the axilla, all right? And they get their names from their relation to the axillary artery. The posterior cord, okay, sitting behind the axillary artery, will go on to form the axillary nerve and the radial nerve. And its posterior position reminds us that it supplies extensors, which in the upper limb are present at the back. The lateral cord, remember we said that lateral corresponds to the superior portion of the plexus. The lateral cord will go on to supply the musculocutaneous nerve, which is to the anterior compartment of the arm, as well as sending a contribution known as the lateral root of the median nerve. So the lateral cord forms the musculocutaneous nerve, as well as sending a contribution to the median nerve. Whilst the medial cord will go on to primarily form the ulnar nerve, running along the medial aspect of the upper limb, and also make a contribution once more to the median nerve. Now, I encourage you, when you're studying anatomy, always look for patterns. Always look for numerical patterns, morphological patterns, because not only will it make anatomy much more satisfying as a subject to study, but it will also enable you to remember the stuff more easily. And there's some quite nice little patterns within just this simple thing that I've talked about here. So if I just point these out to you, we said, didn't we, that there are 5 roots. So there are 5 roots, okay? 5 roots become recombined to form 5 major terminal branches. Now, I am not saying that there are only 5 terminal branches. There are many more terminal branches, but there are 5 major terminal branches, which are formed by 5 roots. There are 3 trunks, okay? 3 trunks, which will recombine through 3 anterior and 3 posterior divisions to form 3 chords. All right? So if you like mnemonics, if you like this way of learning anatomy, which I personally am not that keen on, but if you like this kind of way of learning anatomy, you can kind of remember 5, you can kind of remember 5, 3, 3, 3, 5, okay, which reminds you that there are 5 roots, ultimately giving rise to 5 terminal branches. In between there were 3 trunks, 3 anterior and 3 posterior divisions with 3 chords. So that's a pattern. Always be on the lookout for patterns when you're studying anatomy. So what we're going to do next is we're going to just try to draw out a very simple diagram of the brachial plexus. And the purpose behind this, I'm not trying to make it super memorable. All I'm trying to do is I'm trying to make it a simple format that you yourself can try to replicate. You're going to need to rehearse this. You're going to need to do this multiple times for it to stick in your head. But let's see how far we can get. So let's put on our root values, which we said included C5 through T1. So we've got C5, C6, C7, C8 and T1. Okay, and these give rise to our roots. Okay, so the first part we're going to indicate is the roots, which I shall just abbreviate with an R. And recall from our previous discussion that what we see with regard to the roots is convergence. Okay, so the C5 and C6 roots come together, the C7 root stays alone, whilst the C8 and T1 roots also come together. The convergence of the roots forms the trunks. Okay, so the trunks are formed by the convergence of the roots. And of course, the middle trunk is the continuation of the C7 root. So now we have superior, middle and inferior trunks. We said, did we not, that the trunks then split? So there is divergence to form the divisions. So the divisions are the next part of the brachial plexus that we need to think about. And I find it easiest to initially draw on the posterior divisions, because all the posterior divisions converge together. Okay, so we need to demonstrate the convergence of all of the posterior divisions. Okay, so these are all posterior divisions. And the posterior divisions, whilst we're at it, come together to form the posterior chord. Okay, so the posterior chord is formed by the convergence of all the posterior divisions. What about the anterior divisions? Well, we have an anterior division from the superior trunk, and we also have an anterior division from the middle trunk. Okay, so these are both anterior divisions, whilst the anterior division of the inferior trunk doesn't join with anything, it just continues on. Okay. Now we need to form the chords. We've already put on the posterior chord, and we've shown how that is formed from the convergence of all the posterior divisions. Now let's show the formation of the lateral chord. The lateral chord is formed from the convergence of the anterior divisions from the superior and middle trunks. So this is the lateral chord. Whilst the medial chord is the continuation of the anterior division of the inferior trunk. So now we have lateral, medial and posterior chords. Having done the chords, we can now talk about the final resulting branches, the terminal branches of the plexus. Now let's do the posterior chord first, because the posterior chord, once again, is fairly straightforward. Its major continuation is into the radial nerve, and I'm just abbreviating these with single letters. So the radial nerve is the major result of the posterior chord, whilst we of course also have the smaller axillary nerve. Okay, so the axillary nerve and the radial nerve are the two major branches of the posterior chord. The lateral chord has two major branches. It has the musculocutaneous nerve, okay, and furthermore it also sends this what we might call the lateral root of the median nerve. Okay, so here what we see is the lateral root of the median nerve. And this lateral root of the median nerve is joined by a medial root coming from the medial chord, and they both join together to form the median nerve. Okay. The final nerve that we need to mention is the ulnar nerve, and that arises as a continuation of the medial chord, coming off just after the medial root of the median nerve is produced. So what we've done is just summarised a simple diagram that you could try to replicate, demonstrating the anatomy of the brachial plexus. Just for completeness sake, let's add on to this a few other bits and pieces. The first thing we can add on is our axillary artery, which reminds us that the posterior chord gets its name due to the fact that it sits behind the axillary artery. So here is our axillary artery, just here, okay. And this reminds us that the posterior chord sits behind the axillary artery. What else can we do? Well, we can also just split this plexus up into different regions. So we can put a dotted line here. And this reminds us that the roots are seen at the level of the scalenes. Okay. We can then put a dotted line showing us where the trunks are. And this reminds us that these are in the neck, specifically in the posterior triangle of the neck. We can put a dotted line demarcating the divisions. And this reminds us that the divisions are found deep to the clavicle. And then this final, most distal portion, which is left, is all present within the axilla. Okay? And if you're dissecting the brachial plexus from the axilla, it really is only these portions that you're going to be seeing. As I said earlier, if you want to see the divisions, you need to remove the clavicle. And if you want to see these more proximal portions, you're going to have to explore the neck. So that's all I wanted to talk about with relation to this very simple introduction to the brachial plexus, and I intend to make a second video where we talk about some more complex concepts which underpin the organisation of this very important structure. So thank you very much for listening.